Hey everyone, welcome back to The Explainer. If you think about everything you've ever seen regarding schizophrenia in movies or pop culture, yeah, you can just go ahead and forget all of it. Today we're unpacking a medical reality that is deeply misunderstood, yet entirely treatable. For decades, the media has painted a highly distorted picture of this condition, leaving this massive trail of stigma and confusion in its wake. But today, we're stripping away the fiction and looking straight at the science.
So let's get right to it and establish what this disorder actually is, and firmly toss out that harmful split personality myth right out of the gate. Schizophrenia is a chronic psychiatric disorder. It fundamentally affects how a person thinks, how they perceive the world around them, how they manage their emotions, and ultimately how they behave. It's characterized by disturbances in reality testing, meaning the brain actually struggles to distinguish what is real from what isn't. Bottom line, it is a biological, treatable medical illness.
Here is our roadmap for today. We'll start by moving beyond the myths, then we'll recognize the symptoms, take a look inside the schizophrenic brain, review comprehensive treatment approaches, and wrap up with pathways to recovery. Let's dive in.
Section 1. Beyond the myths. Time to clear the air and look at the clinical truth.
You know, when a lot of people hear schizophrenia, their minds immediately jump to dissociative identity disorder, having multiple distinct personalities. But medically speaking, that is comparing apples and oranges. Schizophrenia actually involves a breakdown in reality testing, which often results in psychosis. It does not involve fragmented, distinct personalities taking over a person's body. Actually, it's more like the person's processing of the world itself becomes fragmented. Understanding this clinical distinction is absolutely crucial in respecting the actual patient experience.
Moving right along to Section 2, Recognizing the Symptoms.
So what does this breakdown in reality actually look like in a clinical setting? Well, what's really fascinating here is how psychiatrists divide symptoms into two main categories: positive, additions to reality, and negative, subtractions from baseline functioning. And to be clear, it's not about good or bad symptoms. Positive symptoms are things that are added to a person's experience, like auditory hallucinations, which are by far the most common, or totally disorganized speech. Negative symptoms are things that are taken away, like a flat affect, where emotional expression is heavily reduced, avolition, which is a severe lack of motivation, or anhedonia, which is the literal inability to feel pleasure.
And speaking of reality testing, let's talk about delusions. These differ entirely from strongly held cultural or religious beliefs. A patient isn't just being stubborn, their brain is feeding them absolute, unwavering convictions. For example, they might experience persecutory delusions, genuinely believing they're being hunted or harassed, or grandiose delusions, believing they possess exceptional power or wealth. Imagine the sheer terror of a nihilistic delusion, the unshakable conviction that a major catastrophe is imminent. These are profound neurological misfires.
By tracing how the disease progresses over time, we can see exactly why early intervention is absolutely vital. Schizophrenia doesn't just happen overnight. It usually starts with the prodromal phase. You might see social withdrawal, anxiety, maybe some mild cognitive slips. And this can actually last for months or even years before the acute psychotic phase hits, which is what brings on the severe hallucinations and behavioral disturbances. Finally, there's the residual phase. Here, positive symptoms might improve, but those negative symptoms we talked about often persist. Catching it early in that prodromal window, it literally changes everything.
So doctors essentially have to play medical detective here. To get the diagnosis right, they have to separate schizophrenia from mood disorders like bipolar. They have to ask, is the psychosis happening entirely on its own? Well, that points to schizophrenia. Or is it triggered only during extreme manic or depressive mood swings? That points to bipolar disorder. And if it's kind of a mix of both, we might be looking at schizoaffective disorder. Getting this distinction right dictates the entire treatment plan going forward.
Which brings us to Section 3, Inside the Schizophrenic Brain.
Okay, let's dive into the microscopic causes and explore what modern neuroscience actually reveals. When we look at functional MRI data, we literally see physical disruptions in the brain's communication superhighways. The prefrontal cortex, which handles all our complex planning and decision-making, shows noticeably reduced activity. The hippocampus, our memory center, and the limbic system, which processes emotions, are physically and functionally altered. So this isn't just in their mind, it's a structural reality that directly fuels those severe cognitive and emotional symptoms.
It really comes down to a perfect chemical storm. You see, the brain communicates via neurotransmitters, and in schizophrenia, we're looking at a massive overactivity of dopamine in specific pathways. This overload is what drives those positive symptoms like delusions.
We also see dysregulation in glutamate, another absolutely vital neurotransmitter. This chemical storm distorts how the brain processes information, which is exactly why medications that target these specific chemicals are so incredibly effective at quieting the hallucinations.
Now, you might be wondering, what actually causes all this? Well, there is no single schizophrenia gene. Instead, it's a really complex collision of genetics and environment. A person might have a genetic vulnerability, like a family history, but it often takes a severe environmental trigger to actually activate the illness. That could be birth complications, severe childhood trauma, or even substance misuse like cannabis later in life. It's essentially a fragile system getting pushed past its breaking point by stress.
All right, Section 4, Comprehensive Treatment Approaches.
So how do we actually manage this based on protocols from organizations like the WHO and the APA? Well, treatment is absolutely never just a pill. It is a multidisciplinary, holistic journey that stacks medical therapy right alongside psychological and social scaffolding. These 4 steps are the gold standard. You assess early. You stabilize the brain chemistry with antipsychotics. But then, crucially, you bring in cognitive behavioral therapy to help the patient manage their reality and apply psychosocial rehabilitation to help them rebuild their life in the real world.
Our pharmacological toolkit has actually evolved significantly over the years. First-generation antipsychotics, like haloperidol, are older and primarily block dopamine. Second-generation, or atypical antipsychotics, like risperidone, target both dopamine and serotonin, and they often come with a very different side effect profile. And for those who just don't respond to standard treatments, medications like clozapine can be an absolute game changer, though they do require strict blood monitoring. At the end of the day, adherence to these medications is the absolute foundation of recovery.
Now, while medication stabilizes the brain, it's these targeted therapies and lifestyle adjustments that actually rebuild a patient's daily life and autonomy. Family therapy is huge here. Educating the family transforms them from overwhelmed bystanders into a powerful, informed support system. Supported employment programs help patients regain their independence. And as for lifestyle factors, strict sleep hygiene and totally avoiding alcohol and recreational drugs are simply non-negotiable for keeping the brain stable and preventing a relapse.
We do have to address a pretty sobering clinical reality directly here. The risk of suicide is significantly higher in patients with schizophrenia. This is particularly true in the early stages of the illness when the reality of the diagnosis really sets in, or when psychotic symptoms become extremely distressing. Safety planning, emergency psychiatric access, and constant empathetic family support aren't just polite recommendations. They are critical, life-saving interventions. And that leads perfectly into our final segment, Section 5, Pathways to Recovery.
The World Health Organization has a very clear mandate here. Treat the whole person. Rehabilitation isn't just an afterthought. Occupational therapy helps patients manage their daily tasks. Cognitive remediation helps sharpen the focus and memory that the illness may have dulled over time. Supported housing gives them a safe, stable base. And at the absolute core of all of this is an unwavering respect for the patient's dignity, their autonomy, and their human rights.
So, what does this all mean for the future? Can schizophrenia actually be cured? Honestly, this is the most common question patients and families ask. We don't have a magic eraser for schizophrenia, but can it be managed so effectively that the person regains their quality of life? Absolutely yes. Much like diabetes or asthma, it requires lifelong management, but a truly fulfilling life is entirely within reach.
As this quote highlights, time is literally everything. The faster we identify psychosis and intervene, the better the lifelong trajectory. Reducing the duration of untreated psychosis is the absolute #1 goal of modern psychiatric intervention. When we catch those prodromal symptoms, when we intervene at the very first episode of psychosis with a comprehensive plan, we protect the brain from further damage and radically alter the patient's future.
Schizophrenia is absolutely not a life sentence of isolation. It is a complex brain disorder that we scientifically know how to treat. By replacing fear with education, we become part of the solution. So I'll leave you with this final thought. How will you use this knowledge to change the conversation and reduce the stigma in your own community? Thank you so much for joining me on this explainer. Keep learning, keep questioning, and I'll catch you next time.